Today is Thursday, October 16th, 8:37 a.m. Today is the day of my surgery. I am having an Optilume Dilation. An Optilume Dilation, it's usually used to treat urethral strictures. Basically what they're going to do is they're going to dilate things, and the end of the tube that they use to dilate things is this sort of medication that's supposed to prevent the buildup of scar tissue. I don't remember what it's called. I think it's called Praxilene or something. It's supposed to be used it's typically used in chemotherapy, I've heard, because it sort of prevents scar proliferation. But so anyways, that's what's being done. I was told that it's maybe going to be an hour long, and obviously outpatient, I would be discharged right after. I was also told the recovery shouldn't be too long. 1 to 3 days I would have a catheter in, and then, a week max for the recovery. As far as pain goes, not really sure. As far as medication, I might have to be on like antibiotics or anti-bladder spasm medications. Haven't really been given information about that. Haven't really been given much info about my post-ops. If my voice sounds a bit sore, that's because they told me not to eat or drink anything. I do think the requirements were a little less strict than for bottom surgery. For instance, they told me that I could drink water up to 2 hours before surgery, whereas bottom surgery I was told nothing after midnight. That's about all I have as of right now. I'm probably going to head out by subway right after I end this video. And I guess I'll update you after it's over. Hey guys, what's up? It is October 19th, it's around 3 days after surgery. I probably should have made a video beforehand, but to be honest, I was just really groggy and tired, really out of it after anesthesia. So yeah, Optilume Dilation, how was it? What was the recovery like? So as far as what things were like, going into the hospital was fairly standard. I think it was a little quicker than with bottom surgery. Obviously, I had to bring all of my cards, my insurance stuff, had to sign the consent forms and whatnot, was dressed up in a gown, was sort of strapped onto the table. I was put under general anesthesia, which is why I'm so groggy and faint. But to be honest, the day of the surgery feels like a bit of a fever dream. I don't really remember much. I know I was discharged with a catheter, and I did feel like it was pretty uncomfortable, bordering on painful. They actually did not prescribe me anything for the recovery. I had to ask for some pain medication at the hospital, and they only gave me 1 pill of Oxy, and that was expected to be all that I was getting. I do remember the day of the surgery, I couldn't really go to sleep afterwards because of how uncomfortable and painful things felt. I remember calling up and asking if I could be prescribed something for the pain, and they basically told me no. They had told me to keep taking ibuprofen and Tylenol. And so that's what I did. Went in the next day to get the catheter taken out. That was mildly uncomfortable, as it always is. As far as voiding after Optilume Dilation, I do think that the surgery was pretty successful. Prior to surgery, it would take me maybe 10 minutes to get everything out. When I say 10 minutes, I'm not exaggerating. Like, literally, legitimately 10 minutes. When it comes to after surgery, it's more like 10 seconds. It's very fast. Now, as far as other symptoms go, I did experience some hematuria, so that's, bleeding while voiding. I've heard that that's fairly common after an Optilume Dilation. I also did experience some abdominal pain, and it was actually pretty severe, I think, in my opinion. It was mainly after voiding. There would be this very intense feeling of cramping, sort of in that area between, my belly button and my groin. But I feel like it's been getting progressively better. I do feel like the surgery has been successful. Hopefully it doesn't end up failing in the future. Hopefully things will end up closing up again. If things do, then I would have to go back and get a urethroplasty. And I'm also not sure how that would affect stage 2 of bottom surgery. All things considered, I do think it's an optimal procedure in the sense that, it has such a minimally invasive recovery. Obviously, I didn't need a caretaker. I've been sleeping a lot, I've been eating a lot, but that's pretty much it. I could basically do anything I want, as compared to a urethroplasty, which may have a little longer and more invasive a recovery. But yeah, that's it for me. Thank you for watching, and I will see you later. Hey guys, this is my 1 week post-op update. I feel like I'm recovering pretty well. I don't feel many side effects or symptoms aside from some pain when voiding. As far as other symptoms go, like, the ones that I was talking about when it comes to abdominal pain or blood when voiding, most of those have died down. It's still residual, it's still present, but nowhere near as bad as it was when I first got out of surgery. As far as life goes, I guess, My recovery has been great. I can, again, do most things. Not really limited when it comes to any activities. But yeah, I mean, that's pretty much it. As far as other updates go outside of Optilume Dilation, I finally got approved for my second top surgery, and that's been pretty cool. And when it comes to stage 2 bottom surgery, I just had the order for my MRA put in, so I guess we'll see how that works out. I think I'm really happy. My quality of life has obviously improved so much. And I feel like I've gotten down to what a baseline normal should have been after bottom surgery, complications aside. Highly recommend Optilume Dilation if you do happen to have a stricture, especially with the less invasive recovery. And yeah, that's all that I have today. Thanks for sticking around.